Uganda remains among the 30 high-burden TB countries, with statistics from the Ministry of Health showing that last year alone, 96,000 new cases of TB were recorded.
96,000 new TB patients. But we detect, last year we were able to get 90,000 out of the 96,000 that we expected. So meaning that the program works, but still we don't reach everyone. Yeah, so we still have people that we have not reached, and we call upon all people with symptoms to go to the facilities and get tested early, because the drugs are free of charge, the testing is free of charge, and all the government hospitals and some private facilities have these services of testing for TB and leprosy, and also the treatment.
The most dangerous patient in the community is one who was undiagnosed with tuberculosis, because each time they sing, each time they speak, each time they sneeze or laugh, they are releasing aerosols into the air and therefore contaminating the air, and whoever breathes that air can actually get infected with tuberculosis.
The TB clinic at Mulago National Referral Hospital, the biggest in the country, still registers a high number of patients diagnosed with TB.
We treat every year 1,200 patients with tuberculosis. Of these patients that we see, about 800 have drug-sensitive TB. This is the TB that is treated with 4 drugs, and the treatment is for only 6 months, the usual antibiotics. And we have about 200 of those have drug-resistant tuberculosis, the tuberculosis that is resistant to the usual drugs we use to treat TB. So for this TB, we treat for longer periods, at least 6 months, but this therapy can go up to 20 months.
However, there's a fear that USAID's cut of funding undermines the strides made in TB diagnosis, care and treatment, and it will definitely be affected.
USAID has been funding 90% of activities that detect resistant TB in their labs, that treat drug-resistant TB, because USAID funding has been buying cartridges that we use for GeneXpert. That is what we use for testing TB in the lab. They have also been supporting activities in the community, finding cases of TB in the community. And once we diagnose a case with resistant TB, the community workers have to go to the homes of these patients to do what they call contact tracing.
As TB program, we really have been dependent more on funding from partners like the US government, the Global Fund, and other partners that we've been working with. But also, very critically, we have also been working with the government of Uganda support. With the cutting of funding from the US government, we are, as a ministry and as National TB program, we are also looking at new strategies. Among the strategies that we are looking at is integration of services, reducing the silos of saying TB being managed in a different corner and the rest. So
TB is preventable, treatable and curable, but is one of the killer diseases. Uganda records 30,000 deaths annually.